Okay, now we're going to go over the SOAPE note. The SOAPE, I think, is 10 or 15 points. I can't remember your grade. You can refer back to the syllabus for that. It's changed some over the years. But as this loads, we'll discuss this. You're going to do this on a patient or a patient's chart or patient information. It does take a little time to do this, so just be aware of that. Now, as you see, it's pretty lengthy. If you ever pick up a medical record or a chart in a hospital or clinical setting, and you see under progress notes someone has scrawled an S, an O, an A, a P, and beside each letter they've written one or two lines or partial sentences. That is a SOAPE format progress note. What you're going to do for this course is an academic SOAPE, and so it is very extensive. I try to summarize this as in you are going to pour out your critical thinking onto paper for us about a patient and their clinical situation. I strongly encourage you to use this outline. Document your work using this outline format and these headings, okay? That will aid you greatly in making sure you don't miss anything. It will also help those who grade your paperwork, which will not always be me, but maybe any of the number of faculty that I mentioned as I went through the syllabus review. But it will help them make sure they see all your components as well. So the first thing you're going to do is you will choose a patient. Now, debating on which clinical area you're at, most of our preceptors, which we've known and worked with for some time, are aware that you will need to do something of this sort. They may not refer to it as a SOAPE. They may say, oh, I know you have to do that paper thing. They call it all sorts of things. But they are usually in the mindset, if they've worked with our students very much, that they know that you're going to need to find a patient to do this on. And so sometimes they will help you find that patient. But regardless, you choose a patient that you have access to them and their information. You're first going to make a statement of encounter. You're going to, in the statement, say who, what, when, where, and why you are encountering this patient. So let's say you are at an urgent care center and you are encountering a patient, and this is kind of what your statement of encounter will sound like. 77-year-old white male coming to the clinic with complaints of headache, fever, congested cough, etc. You're going to put just a couple of sentences that introduces the patient to us, and it helps us get a picture of your patient. The next section is your subjective data. So CC is chief complaint, and it's in the client's or family's own words. So at this point, you should be putting something here in quotations. Mr. Jones, how are you feeling today? Maybe what you ask. And his reply is, I feel really bad. I'm terribly short of breath. So you would put here in quotations, I feel terribly bad. I'm incredibly short of breath, or whatever it was he said, okay? The patient or the family member or the primary caregiver. The present illness, you're going to describe the present illness, and you're going to remember to address it through the 7 parameters of your present illness, which you're going to ask and find out when the onset of the symptoms were, how bad they are, what brings them on, how often they're happening, what makes them worse, what makes them better, how often. Sorry that's repeated there. I didn't realize that was repeated. I just looked at it. And what other symptoms they may have. And then you're going to ask them what they're doing to treat themselves. Are they taking any over-the-counter meds? What's their regular medication routine? Are they taking any home medicines? When you list these medicines here, we expect them to be in complete format. And what I mean by that is anytime you document a med completely, you're documenting it as name, dose, route, frequency, and reason. Just think of this as early NCLEX preparation, so make sure you document all your meds generically. Make sure that you're knowing why the patient is taking them. because we're going to be watching for that. If you fail to document your meds in complete format, you're going to automatically lose a big chunk of your grade. If you're in a clinic and you administer any type of vaccination, we also expect, or any injection whatsoever, but for any injection, you're going to put the site that you gave it, of course. But for any vaccination, you're going to also document the lot number and the expiration for that, for it to be complete documentation. You're going to list here past medical history. You're going to get as much as you can on this. You're going to list, are they up to date on their vaccinations? Have they had significant past medical history? Do they have allergies? If so, I want to know what their reaction is. This LMP is last menstrual period, and we expect to see that documented for any female ages 10 to 50. Likewise, if they're sexually active, we expect to see if they're using any type of birth control measures. Some of this information is going to be easy to get. You can get it from the chart. You might ask it from the patient. Others, you just going to have to do the best you can through here, okay? Family history, same thing. Get as much information as you can. Now, as we go through this, you might be thinking there's going to be a lot of information I won't have time to get or I'm not going to be able to find. We know that. But we want to know what information you would have liked to have found and why. So if you're dealing with a patient who's a diabetic and you didn't get the opportunity to ask if the family has a history of diabetes, you would come back here in the family history and you would put in a different color of ink or different font. I would have liked to know if multiple members of the family were also diabetic, because we're going to look for that, because that tells us you're thinking that. Remember, we want to see your critical thinking put out on paper here for us to determine if you're thinking about this patient holistically and in a critical way. Psychosocial, personal, environmental, you're going to state whether they're married, they're single, what type of education level, can they read and write, what type of heating do they have in their home, what type of water, do they smoke, if so, what have they smoked and for how long. But all of this is pertinent to what's going on with them too. So you've got to think about it in that frame of mind. For your ADLs, you're going to ask them about, so sorry about that, nutrition. And you're going to ask them about sleep habits, and you need to get some specific information. Do you sleep well at night? Yes, you do. Well, how many hours of sleep is that? And how often do you get up to go to the restroom in the middle of the night? Those types of questions. You're going to put that under ADLs. This ROS is review of systems. Usually you write that in somewhat of a head-to-toe format. And what is a review of systems? This is all subjective information you're getting in this big category here. So review of systems is you're pretty much going to ask them in a relatively quick time frame about their symptoms they're having, so it keys you into their problems. So you may ask, are you having any headaches? If so, how frequently? Do you have any problems with your vision? Any problems with your hearing? Do you ever feel like your heart is beating too fast or it skips a beat? Do you ever feel like you're short of breath? If so, when does that happen? Do you have any problems with your stomach? Are you having any problems with indigestion or heartburn? Do you have any tenderness in your stomach? How's your elimination? Are you able to go to the restroom and urinate without any difficulty or burning? Are you able to have regular bowel movements? When was your last bowel movement? So on. And you're going to do that from head to toe with a lot of emphasis on whatever body systems refer back to their chief complaint. So just keep that in mind. So just know that review of systems is subjective. So everything that comes under this review of systems should be in a verbal reporting type format. So you may say, list HEENT for head, eyes, ears, nose, and throat. And you may put denies headache, reports frequent ear ringing, those types of things. So everything under that section should be states, reports, denies, those types of words, okay, because it's all verbal information. And then under developmental history milestones, remember this is all subjective, so it's going to be things like able to hold a pen, appears to have fun, or states no problems with walking, states completed a high school education, those types of things about meeting milestones. And then in section 3 here, and my recording software I'm using will only let me do 15 minutes at a time, and I'm on 10 right now, so I may have to break this SOAPE explanation into 2 sections, just to let you know. So, but we'll start objective here, and under this general overview, you're going to give us a picture of your patient. Well-nourished, white male, walks without aid of mobility device, skin pink, makes conversation well. You're going to give us just a few sentences here, giving us a little bit further of a picture of the patient that you're seeing in their surroundings, whether it's in the clinic, whether you're doing home health and you're in their home. That's what that section's going to call for. Patient-caregiver interaction, that can be the patient and you as the nurse, the patient as and the other healthcare professional. It can be the patient and their primary caregiver. Do they speak easy to each other? Do they speak well to each other? Do they make eye contact? Just put what you see here. For vital signs, height and weight, try to get as much of your vital signs as you can. It's going to depend on the site where you're doing the SOAPE in, but if you do height and weight, we expect to see BMI. If any of your vital signs are out of what's considered the normal range for the patient, you need to highlight those, put those in a different color font, draw our attention to them to let us know that you recognize that they were out of normal ranges. Head-to-toe assessment. Just like you did your review of systems head-to-toe, you're going to do a head-to-toe assessment with your objective information. Now, depending on your clinical site, you may feel like you can't lay a stethoscope on everybody, you can't palpate everyone. Don't forget that one of your assessment tools is inspection. And if I were standing in front of you as a classroom right now, I could look around and tell you, does everyone look like they're breathing easily? Do they look like they have good color? Or does it look like somebody's getting ready to pass out and hit the floor? So you can put a lot about your head-to-toe assessment just from looking at your patient and taking in those inspection findings. Again, just outline this head-to-toe assessment in a very well-organized head-to-toe fashion. Depending on your site, you may or may not have labs to report here, so if you do not, just put NA or none drawn. Under growth and development, we have some sections here that fall under that. The first one being Erickson's. You may remember that from your sophomore 2, junior 1 and 2, when you did the care plans. Erickson's, you ask, so if I'm dealing with my patient's a 19 to 22, 23-year-old, Erickson's stage of intimacy versus isolation should be where they're at. So for this section, I would put this patient should be in Erickson's intimacy versus isolation. Here are some common actions or characteristics of that stage, and I would list a few, and then I would tell why or what my patient said or did that confirmed to me that my patient was in that stage of Erickson's. Remember, some people, depending on their situation, are not in the expected Erickson stage. So tell us what the common characteristics are, why your patient, which stage you put them in, characteristics of that stage, and why you feel like that, yes, they belong in that stage with evidence to support. Again, here you're going to address gross fine motor. How is their language? Are they able to hold a pen? Are they able to write their name? You're just going to list some things here that you observe. For kilocalorie requirements, you are only going to do kilocalorie requirements for a pediatric patient or for an adult who is having some nutritional issues. Perhaps they have they may be undernourished due to their disease condition. They may have a feeding tube, something like that. But other than that, you can put NA or none. So before I get into this last bit, I'm going to end this video and go to the second part in order not to run out of time. So I'll see you again here in just a second.